Hello everyone, welcome to Close Up on America's Business, the program that takes you inside some of the most unique and successful companies in America. I'm Janice Marie. On each edition of our show, you have the opportunity to meet some of the most innovative business leaders in the country today. You'll find out what their products, services, technologies, and business models can do for you, and what they're doing to change our world and to change the way we do business.
In the world of medical and surgical treatments, cosmetic surgery has emerged as one of the most popular and fastest growing of all. Perhaps that's because in this day and age we live in, people just want to look good and feel better about themselves. And now they can, and that holds true for both men and women. From facelifts to remove excess wrinkles and restore youthful vitality, to liposuction treatments to remove excess pockets of fat, doctors these days can achieve amazing results that really end up in helping to actually change people's lives. And that's the impact that happens here on practically a daily basis at the Peer Group Plastic Surgery Center in Florham Park, New Jersey, where 4 highly qualified, board-certified plastic surgeons perform the very latest in cosmetic and reconstructive surgery treatments. To learn the latest that's going on in this field, we talked at length with the doctors and we observed some of the various treatments.
Well, we're a group of plastic surgeons dedicated to providing the best care for plastic and reconstructive surgery and for our community. My main focus is on the aesthetic patient. It has to do with facial aesthetics, facelifts, eyelids, noses, and body contouring, whether it's breast augmentation, breast lift, breast reduction, a lot of liposuction. Those are the areas where we put most of our effort here.
Dr. Lang was just wonderful. He listened to everything I had to say, came back with what he said he wanted to do, which was everything I wanted to hear, and it was perfect. I had a neck lift, and my eyes, which, you know, I'm over 50, so I had my eyes done, and it was right here in the office. You didn't have to go anywhere. It was like coming home. It was easy on you. It was one place, one stop. You spent the morning here, and the surgery was done, and you went right home afterwards. It was nice. I never liked having my picture taken. I never liked my profile. With the surgery, it just doesn't bother me. I feel a lot better about myself. I'm glad I made the decision to have it done. It was the best thing I ever did.
The main advantage is that we, as a team, are greater than any one of us could be as an individual. We sort of pool our resources in every way, basically. Intellectually, we can cover a lot more meetings, and we can do a lot more reading with 4 guys looking for what's important and what isn't important. And then we always talk and we share knowledge, and we're always trying to help each other become better surgeons. This is a very fortunate group in that we get along very, very well. Our main focus amongst ourselves is doing surgery. We all love plastic surgery. We pride ourselves on being good plastic surgeons and being the best that we possibly can, and everything else sort of falls into place after that. If you're good, you're up to date, you do a good job, you'll do well.
I wasn't happy for the last bunch of years, honestly, about my neck and my chin, but I never really knew what to do about it. I just didn't like it. I just came in to see Dr. Harillo. I didn't know anything at all. I knew nothing. I came in here in the morning. Everybody was so nice. I mean, anybody asks me, I will tell them to come here. So I had the surgery. It was two and a half hours. I had a neck lift and a chin. That's what they did. I wanted my jawline back. And I had this done. Everything has gone exactly as they said. When the swelling would start to go down, when the bruising would start to go down, when everything would be good. I'm ecstatic. I would recommend it to anybody. It was wonderful.
She basically got the result that she was asking for, which was to be larger than she was, replace the deflated implant. She just fills out her tissue well. She looks natural. She's not going to attract any attention, but she's going to just be symmetric. Her upper body and her lower body match, and she's going to feel real comfortable both in clothes and bathing suits, so it's a perfect outcome. You really have to look at the kind of three-dimensionally add a little bit more, compare the two sides. You don't have little ways to kind of measure them, and you just have to size it up and manipulate the pockets. You have to have that good three-dimensional sense. Well, in this case, because her prior surgery had been done that way, so I used the same scar.
All our products are medical. They are medically supervised. They can't be bought over the counter or in a salon, and they're very effective that way. We can prescribe any type of Retin-A or hydroquinones that even out the skin tone, unlike a salon. Also, our equipment that we use is medical. It's type 2, what they call equipment. So they're also a little bit more effective.
I tell everybody, as soon as someone says, "You're 52 and a grandmother," I say, "Yes, and I have a great plastic surgeon. Look at this." So I love Dr. Starker. Could not recommend him more highly to anybody. The brow lift, he made an incision here and he pulled that up. The facelift went from here to here, and I told him, I was very specific. I said, "Please don't make me look weird. I want to look like me, just with less jowls and, you know, a little bit better." I am thrilled with the procedure. I'm thrilled with the peer group. I'm thrilled with Dr. Starker. I cannot speak highly enough of him.
Most of our patients are pretty well educated and have done a reasonable amount of research beforehand. There's a lot of subtlety involved in deciding what kind of a procedure is best for a given person, and certainly a lot of the pieces that present themselves in magazines or on news programs make it sound like whatever is being discussed is the best procedure for every person that's out there, and that's not necessarily the case.
There is something very special about this. Not only is everybody, from the person that answers the phone to how they greet you, this place is so clean, to how personable Dr. Colon. I felt like I was the only patient he had. Never rushed me, answered all my questions, and was honest with me. You know, afterwards, you know, it's very important to know what to expect, especially after doing the things that I did, knowing that you're not going to be able to, you know, sit right up. You know, you go to get out of bed, you want to know that you're not going to be able to do that, and that's normal. So from honesty to professionalism, and I had some liposuction done. I had lipo on my legs, on my hips, and on my stomach. Everybody here is wonderful.
We've learned now that as our face ages, one of the principal changes is a loss in volume, whether it's a change in the skeleton or loss of facial fat. We've learned that by replacing that volume, we can often obtain more natural rejuvenation effects than lifting. For many patients, it is actually the best treatment. The best way to rejuvenate their face may be actually filling the face, not pulling.
A look at the latest in cosmetic and reconstructive surgical treatments as performed by the doctors here at the Peer Group Plastic Surgery Center. I'm Doug Llewellyn reporting from Florham Park, New Jersey.
Well, that does it for this edition of Close Up on America's Business. I'm Janice Marie. Thanks for joining us. We'll see you next time.